Alright guys, as I mentioned in my previous videos, I'm doing a video series on beating Lyme disease. I wrote a book on my experience with Lyme disease. I had a bullseye rash on my thigh back in 2010, and that's where I learned about Lyme disease and its co-infections. The co-infections are really the important part that is unknown or less known. So basically, this is video 3. I'm going to cover a few different areas of treatment that I tried before I led to my end treatment that I was successful with, or that I have been successful with. So basically, as I mentioned before, I had tried antibiotics. I was taking them for a couple months. It was bothering my stomach. I was also taking organic supplements, different things basically to try to help with alleviate the stomach issues and also help with the Lyme disease. However, I just couldn't find the right balance. As I mentioned before, I also may have been having a Herxheimer reaction, which is the bacteria dying off, and then that would cause symptoms very similar to the actual symptoms, or having a flare-up of the symptoms. So long story short, after the antibiotics and the supplements, I wanted to try and find something new. I did some research and I found bee venom therapy. Now, I know this sounds a little crazy. This is something that it wouldn't be even considered in modern medicine, right? However, it's been used in ancient Chinese medicine for thousands of years. As we all know, a bee stings somebody once and then a bee dies. So in a way, a bee is like a hypodermic needle, where it should be clean and sanitary and not have stung other people and gotten infected or gotten infections on the bee stinger. So that's the first part. The second part is the venom itself. So there's a lot of different compounds in the venom. One of the main positive compounds is actually called melittin. Melittin is used for several different things. It helps the skin, it reduces inflammation in the body. Also, there are some negative things in the bee venom. However, if I sting my wrist and I have a sprained wrist, my body will rush everything needed to heal that bee sting, and as it heals the bee sting, it'll hopefully heal my sprained wrist. So if you have nagging injuries or swollen joints, this could be a potential for that. Also, I read that if you use bee venom for a couple of years, it could apparently boost your T cells and thereby get rid of Lyme disease naturally, or your immune system would, by creating more T cells and naturally destroying the Lyme disease in your body with your natural, more powerful immunity. So those are just some reasons why I thought it would be a good idea to try bee venom therapy. That, and I guess I was kind of desperate at the time. So now I'm going to go a little bit into the bee venom therapy itself. One thing to keep in mind with the bee venom therapy: bees can be deadly if you're allergic to them. So you're going to want to talk to your doctor or find an EpiPen, get an EpiPen prescribed to you somehow, some way, and keep that on hand. Even if you aren't allergic to bee stings, an allergy could pop up and all of a sudden you could have an anaphylactic shock and you wouldn't be able to breathe, etc. So keep an EpiPen on hand, please, if you ever try this therapy. I guess I was in a position when I first found out about this, where I found out about it, and where do you find bees? How do you get the treatment administered? The steps go on and on and on. So long story short, I found a beekeeper in North Carolina, actually. Very nice lady. I believe I actually found her through YouTube, crazy enough. I contacted her. She sells me bees, basically. She, not currently, but she was selling me bees for about a year. She would send me probably 50 bees a week, or actually probably 80 bees a week, because I got up to a point where I was stinging myself about 60 times a week. They say you're supposed to do it 3 times a week, about 10 stings per time. So like a Monday, Wednesday, Friday, 10 stings up and down your spine. Yes, it sounds crazy. Yes, it is painful. It did actually help. When the bee sting hits you, you could imagine it gives you adrenaline. And then I feel it gave me energy and helped with my lack of energy. I also feel it boosted my immune system and improved my skin. So these are my opinions. It's just what I noticed in my observations. I mean, I'm pretty health conscious. I was at the time especially. So I would say that I would notice if there was a change and that kind of thing. I would say that it did have some negative effects in that the bee sting areas were swollen and they were itchy and they wouldn't heal. So those were some negative effects. Otherwise, I feel that it did help with energy. I feel that it did reduce my symptoms. I did it for about 9-10 months, right around there, maybe a little more. And I had to kind of step back from it. I just was getting too itchy and too uncomfortable, and I kind of dreaded getting stung. But I might have done too many. Doing 60 a week is double the recommended dose, and maybe I was doing too much. I was working out hard and just trying to give myself a boost. So now this therapy, with purchasing the bees, like I said, I was probably getting 80 a month. That wasn't too expensive, but the shipping was kind of expensive, so I would say I would probably spend $80. Let's see. Each week I needed 80 of them. So each week I had to purchase the bees. I'm just going by memory, and if I recall, I was spending $200-300 a month in total. And I would give my nephew $20 or so every time he stung me in the back, so it adds up. If it's 60 a week just to get stung, and then it's 50, 60 a week for the bees, you could see it's going to add up $400. So, and again, it probably depends how many you're using and if you're paying somebody to sting you, etc., etc. They do have options where you could take your bees and you put them in this little container and you get like a CO2 cartridge, like for a BB gun, a little silver CO2 cartridge, put it in there. The CO2 puts the bees to sleep. So you take the sleeping bees and sting yourself. And people can sting themselves really wherever they want if you have issues. But I've heard along the spine, next to the spine, is one of the best places or most common places to do that. Besides the CO2 to put the bees to sleep for an option, they do also have powdered and dried bee venom. So I think I got it from Switzerland or something like that. If I recall, I basically ordered it online. They sent me what looked like, a white powder in a little vial. I had to mix saline in that. I had to get these syringes and everything, like diabetic needles. I had to get saline. I had to get a large syringe and all that kind of stuff to help mix it. So it was like doing chemistry in high school, or like doing a chemistry experiment or something. I mixed all this stuff up, and I was terrified to inject it into myself. I was worried, what if this stuff isn't actual bee venom? I don't know where it came from. It's not an approved source. I'm scared of needles to start with, and I'm just supposed to inject it into my fatty tissue in my thigh was the directions, and you're supposed to draw back and make sure you don't have blood in the needle. And I'm scared of needles, you guys. I don't know how else to say it. And some pain like that, I'm sensitive to it. So, it felt like I was hitting myself with a hammer when I was injecting it into my thigh, basically. So, I'm sitting there choked up, tearing up doing it. It's so bad. So that can be painful. The bee venom or the actual bees themselves are a little less painful, but you're supposed to leave the stinger sac in you for like a few minutes so it stays in you, the stinger, and it pumps the toxin or the venom into you, and then when you're done or after they're in there for a few minutes, you pull them out and that kind of thing. So that's kind of the process and the costs and the different options for bee venom therapy regarding Lyme disease treatment or any immune system deficiency. I've heard of people using this for multiple sclerosis and different things like that, but again, this is personal preference. This isn't a cure for anything. It's just something that maybe will give you more of a natural boost. Guys, so my next method of treatment that I tried, I researched oxygen chamber therapy. I actually found there was a local option in my city, so I called them up. I checked the cost. For a 2-hour session, it was $400. These doctors recommended that I go 5 times a week for like 2 months. So as you can imagine, it's very expensive. I went and did it. Basically, it's a large glass see-through pop can shaped area with a bed in it. You're just kind of laying there in that large glass pop can that gets pressurized just like a pop can, and it's a similar pressure to being 50 feet underwater. I believe it's around 2 atmospheres, but I could be mistaken. I believe it's 2 atmospheres, it would be called around there. So you go in the oxygen chamber. It's an oxygen rich environment combined with pressure, and this helps get oxygen deep into your tissues. It apparently increases blood flow and oxygen like hundreds of percentiles in the tips of your fingers and the tips of your toes, and where you would normally have issues with blood flow and healing and things like that. So if you had sores on your feet or fingers, tips of your fingers, or trouble healing, the oxygen chamber would be great for healing. And concussions as well. All of the small blood vessels and capillaries and everything in your brain, it's hard to get anything in there to heal them, but the oxygen and the blood flow helps provide healing and nourishment and reduce inflammation to an inflamed brain caused from a concussion. So similar idea here with the Lyme disease. They say the oxygen kills the Lyme disease. So they can't live in an oxygen-rich environment. So by going for a long time, the goal would be to kill the Lyme disease as you go through. This was my hope and this is my plan. I didn't know if it would work. I tried for 2 months and it worked. I kept my symptoms away for 4 months, but when they came back, they were terrible. I had to run and help somebody move across the country, and came back, and I had a layover in Chicago, and it was really stressful. And I came back, and I tell you what, my symptoms were terrible. I mean, I was at the bottom of the barrel. So these different cures that you try, be cautious, because this stuff comes back. The Lyme disease bacteria, it seems to be, I've read it's intelligent. It can change shape when it's introduced or exposed to antibiotics, and basically it can mutate and it can come back stronger. So beware different treatments that do not cure the Lyme disease. And in my last video here, we will be talking about something that could potentially, hopefully, eradicate it. So after the oxygen therapy, as I mentioned, my symptoms were awful. I felt terrible. I needed to try something else, but I didn't know what. I felt like I was running out of options. I saw there was hypertherapy, which is an induced fever. I saw that there was different options with ozone being added to the blood combined with pressure, called the 10-pass method. I heard of peptides, all these different things, but I never heard of anything curing my Lyme disease. So I was just desperate to get symptom relief at this point. I basically got an ozone machine and a small little portable sauna. You pipe the ozone into the sauna and you get a respirator. You have a fan blowing on your face, and basically you sit in the sauna for 20 minutes a day. I only probably did this a half dozen times, so maybe even a dozen times. It did make my symptoms go away, shockingly. I couldn't believe it. However, same thing with the oxygen chamber therapy. About as long as I did the therapy is as long as the symptoms stayed away. So if I did the therapy for a week, they were gone for about a week or 5 days. And when they came back, they were more powerful and worse than ever. So I was at the very, very bottom, the very, very end of my wits, and I didn't know what to do. And that's when I started looking at actual Lyme disease doctors. I guess, you see, I thought I was smart and I could figure this out on my own, and I didn't put much faith in the regular Western medicine. I had tried and failed there. Didn't put that much faith in the Lyme disease doctors because I'd never found anything regarding a cure from them, until one night when I was struggling with these symptoms after the ozone. I was at the end of my rope and I found something, and I'm going to talk about that in the next video. I can give you the acronym here so I don't leave you hanging. You can look into it a little bit on your own if you're watching this one and don't want to jump to the next one, but it's called the SOT. Acronym SOT. Look into that. If you want to find a cure, look into that.